Depression and anxiety affect about 50% of people living with Parkinson's disease, while about 30% of people living with Parkinson's disease reports changes in memory and thinking ability. Hi everyone, Dr. Meka here again. If you're new on this channel, welcome. Please click on the subscribe button if you have not already done that. Turn on your bell notification so that anytime I drop new videos, you will be notified. Like and share this video. Please subscribe. Each person's experience with Parkinson's disease is unique, as well as their symptoms and management strategies. You see, learning how to navigate through the symptoms can take time, but ultimately empowers you on how to live better with Parkinson's disease. Today, I'm going to discuss common movement and non movement symptoms of Parkinson's disease. Parkinson's disease impacts the brain ability to produce or create the chemical called dopamine. This feel good chemical plays a very important role in our body system. It helps the body move and stay coordinated. And when the brain is no longer able to produce enough of this dopamine, then the body responds with tremor or movement or balance issues or slow movements, which might be early signs of Parkinson's disease. There's no single test or scan for Parkinson's disease, but there are three hallmark symptoms that can help guide your doctor in making the diagnosis for Parkinson's disease. Tremor is the earliest sign that a patient with Parkinson's disease will present with. About 70 to 90% of patients with Parkinson's disease had experienced tremor at one point or the other in their disease stage. Tremor tends to occur in the hands and other part of the body, like in the lower lips jaw or in the legs, causing bradykinesia or slowness of movement. Another symptoms of Parkinson's disease, in addition to slow movement, is that an individual will experience a small or movement of a reduced amplitude. This means that one arm might be swinging, there could be less walking, and handwriting that gets smaller and smaller as an individual is writing, the handwriting becomes smaller and smaller. Okay. Now, rigidity is another defining symptoms of patient with Parkinson's disease, as they feel there's stiffness of either the legs or the arms. Okay, and it could affect both sides of the body. So this simply means that there will be a reduced uh, movement or reduced motion, okay, a decrease in range of motion that the individual will be experiencing, as they will not be able to perform the task which they are used to. It simply means that Parkinson's disease affects individual differently. Although Parkinson's disease is diagnosed based on these primary movement symptoms, there are many other symptoms that are associated with Parkinson's disease, some of which develops over time. Just like movement symptoms, non-movement symptoms are caused by imbalance in the brain not producing enough dopamine, the chemical that help to regulate our mood. Now, when the brain is not able to produce enough of this chemical plus other chemicals that helps the body, then the individual might develop anxiety, depression, and all other myriads of symptoms. Parkinson's disease isn't just about a tremor or trouble with walking. Many people with Parkinson's disease develop non movement symptoms such as loss of smell, they have constipation, they have trouble with sleep. So their circadian rhythm will change and they are now able to sleep right at night. Now, all this would have occurred even long before the diagnosis of Parkinson's disease is made. All the earliest sign of Parkinson's disease can be found in the enteric nervous system, which is the nerve cell throughout the gut. About 80% of the people with Parkinson's disease will develop gastrointestinal issues, while about 50% of them will develop mental health challenges such as depression, they have anxiety, and it has also been reported that appreciable number of them too have issues with memory problems and inability to think. There are many other non-movement symptoms of Parkinson's disease, which include dizziness, vertigo. Your doctor will help determine which of the symptoms that you're experiencing, since Parkinson's disease is caused as a result of decreased dopamine action in the brain. So, there are medications that are aimed at replacing the dopamine actions in the brain or mimicking the actions of dopamine in the brain. These medications are called dopaminergic. The aim of this medication is to reduce the muscle rigidity, helps improve coordination and movement as well, and then reduce tremor. In addition to medication, exercise should be part of the daily routine of a patient with Parkinson's disease. Physical exercise helps to maintain and improve mobility, flexibility, and balance, and also help to ease non-motor symptoms such as constipation and depression, and it helps in the overall well-being of the patient. Hope you enjoyed this video. Please don't forget to subscribe, share this video. See you in my next video. Thank you for watching. Atutale.